welcome to the Euvie podcast. Today's episode will be about the cervix. The cervix is the lower, narrower part of the uterus, and it connects the body of the uterus to the vagina or birth canal. The cervix makes mucus to lubricate the vagina. This serves the function of allowing easier childbirth and intercourse. The cervix aids in safeguarding the pregnancy by staying taut and closed to keep the child in, and then dilating during birth to allow the child to be born. The cervix is about 2 centimeters in length, but this can vary greatly from woman to woman depending on age, menstrual stage, and whether she has given birth or not. The cervix is made up mostly by connective tissue. There is no one single standard cervix. It is constantly changing size, shape, and texture depending on a woman's menstrual cycle, hormonal conditions, and whether or not she has given birth. The cervix swells just before ovulation, and the external os becomes soft due to the rise of estrogen. Around the time of ovulation, the cervix also secretes stretchy, clear mucus into the vagina to encourage the travel of sperm into the uterus and thereby promote fertilization. After ovulation, the hormone progesterone causes the cervix to become hard and closed. It also causes the glands in the cervix to secrete thick, opaque, or cloudy mucus that exudes into the vagina as well. This mucus acts as a plug within the cervix, thereby preventing pathogens or microorganisms from entering the uterus. During this time, pregnancy is very difficult because the plug also acts as a barrier of entry for sperm into the uterine cavity. The cervix is split into 4 main areas: the Acto Cervix and the external os, and the Endo Cervix and internal os. The Acto Cervix is the area of the cervix that is visible through the vaginal canal. It has an opening called the external os that opens into the vagina. For women who have not given birth yet, the cervical opening appears small and circular. For those who have given birth, the opening appears more like a slit. The endocervix, on the other hand, is the cavity of the cervix that connects the internal os to the external os. The endocervix is spindle-shaped and tapers at both ends. It has slanting ridges called the plicae plumentae that interlock like a zipper to keep the canal closed. Lastly, we come to the internal os. The internal os is the opening of the cervix into the uterus. The tissue makeup of the cervix is also incredibly complex. There are 2 main types of tissues, called the epithelium and the stroma, which make up the endo and ecto cervix. The ecto cervix is lined with epithelium that is split into the basal, parabasal, intermediate, and superficial layers. Active mitosis, or cell division, occurs in the basal layer of the epithelium, which overlies the stroma. The parabasal and intermediate layers make up the prickle cell layer, which is a layer that consists of tightly bound cells, the connections of which gives them a prickly look, hence the name. The superficial layer is the outermost layer of the cervix, which varies in thickness depending on the hormonal changes in the female reproductive system. The endocervix, on the other hand, is coated with deep, cleft-like infoldings that lie underneath a series of mucin-secreting columnar-shaped epithelial cells. The area where the endocervix and the ectocervix meet is called the squamo-columnar junction, or SCJ for short. This is where the rectangular columnar cells of the endocervix change into the scale-like squamous cells that line the ectocervix. This area is called the transformation zone. The location of the transformation zone varies between women. In teenage girls, for example, the transformation zone may be located on the outside of the immature cervix, and for older women, it may be located further up within the cervical canal. Because the transformation zone is usually located closer to the outside in adolescence, it is more susceptible to infection. Now, we will take a 1-minute break before diving into some of the diseases of the cervix. Cervical cancer. One of the most devastating diseases of the cervix is cervical cancer. As with any disease, the key to treatment and recovery is early detection. Cervical cancer does not spontaneously develop. Because most cervical cancers begin at the transformation zone, the cells gradually develop abnormalities and mutations that morph into cancer over time. Because of its cumulative nature, cervical cancer can be prevented. Routine Pap smears are the key to preventing cervical cancer. Pap smears can find precancers before they turn into cancer. Keep in mind that usually precancers take several years to turn into full-fledged cervical cancer, though rarely they may turn cancerous in less than a year or two. Precancers detected on Pap screenings can be treated before they turn into full-fledged cervical cancer, though for most women, cancerous cells tend to go away on their own. Either way, cervical cancer is very preventable. Another way to prevent cervical cancer is to prevent the precancers themselves. There are several ways to do this, including getting an HPV vaccine, not smoking, and avoiding exposure to HPV, but these methods do not substitute for Pap smears. However, if cervical cancer has developed, there are treatment options. The treatment options for cervical cancer depend on the stage of the cancer. The general treatment options are surgery, radiation therapy, chemotherapy, and targeted therapy. For the earlier stages of cancer, surgery combined with chemotherapy and radiation therapy is used. For the later stages, chemotherapy and radiation therapy are usually used. And for the latest progression of cancer, chemotherapy by itself is used. It is important to ask your provider about Pap smears, precancers, and cervical cancer. Moving on to cervical myomas. Cervical myomas are smooth, benign tumors in the cervix. They don't usually develop in the cervix, and in the rare event that they do, they are usually accompanied by myomas in the upper uterus too. They're also called fibroids as they are predominantly comprised of muscle tissue. Larger myomas can protrude into the vagina, develop sores, bleed, become infected, or block the urinary tract, increasing the risk of getting a urinary tract infection or a UTI. Some of the symptoms of cervical myomas are heavy or irregular bleeding, pain, discharge, and in rare cases, a feeling of a lump in the abdomen. Heavy or excessive bleeding because of a myoma can lead to anemia, fatigue, or weakness. Pain during sexual intercourse may also be experienced. If myomas cause symptoms, surgery is usually needed. This surgery, called a myomectomy, removes the myoma. In most cases, the woman can still bear children. However, if the myoma is large enough, a hysterectomy may be needed and the entire uterus may have to be removed. Another condition of the cervix is cervical stenosis. According to the Merck Manual, cervical stenosis is the narrowing of the passageway through the cervix. Oftentimes, this results in infertility. Some women are born with this condition, but for others, it can be the result of having had another disease. These include cervical or endometrial cancer, cervical surgery, endometrial ablation in women with persistent vaginal bleeding, radiation therapy, or going through menopause. Symptoms include no periods, painful periods, infertility, or lower abdominal pain. If it occurs by birth, which is extremely rare, it is usually diagnosed when menstruation does not start by 14 or 15 years of age. These patients typically complain of cyclic lower abdominal pain as a result of the buildup of menstrual blood within the uterus every month. This condition is called hematoma. Diagnosis is done by ultrasound. Cervical stenosis may also result in the buildup of pus in the uterus, which is a condition called pyometra. This usually occurs in women past the age of menopause, but pyometra is commonly seen in patients who have associated with endometrial or cervical cancer. There may be no symptoms of cervical stenosis past menopause, but the disease may still be present. Cervical stenosis is typically treated only if the woman exhibits the above-mentioned symptoms. Treatments include widening of the cervix by using serially calibrated metal rods called dilators, or a cervical stent placement for 4 to 6 weeks. Although technically not a disease, a short cervix can create some complications during pregnancy. Although there is no specific known cause for a short cervix, there are some factors that may put you at risk. These include having a uterine defect by birth, having had a cervical surgery, or having cervical injuries as a result of a previous birth or miscarriages. A short cervix may not be able to stay closed during a pregnancy and may give way, causing the child to be born too early. In the case of cervical insufficiency, the cervix, instead of being hard and closed, may open midway through pregnancy, even without contractions or labor pains, causing a premature birth. If a provider suspects that you have a short cervix, he or she may diagnose the condition via ultrasounds inside the vagina, starting at 16 to 20 weeks of pregnancy. The specific treatment includes having a cervical circlage, which is a suture put in the cervix to prevent the cervix from opening too early during pregnancy. In addition, your doctor may also prescribe vaginal, oral, or injectable progesterone, which is a hormone used to strengthen the cervix and maintain uterine quiescence until full term. That's all for this episode of Euvie. We hope to talk to you next time. Thank you for listening.